Hi, everybody, and welcome to our August monthly webinar. My name is Lesley Gabrielle Harvey of the Hawaii Business Consultancy and Board President of the Hawaii Economic Association. Now, before I turn it over to Sumner, let me properly introduce you. Sumner Croix is a professor emeritus in the University of Hawaii Manoa Department of Economics and a research fellow with the University of Hawaii Economic Research Organization. His research focuses on the economic history of Hawaii, institutional change, property rights in land, intellectual property rights, and labor markets in the Asia-Pacific region. He's on the editorial board of Journal of Economic History and is associate editor of Asian Economic Journal and Australian Economic History Review. His new book, Hawaii, 800 Years of Political and Economic Change, was published by the University of Chicago Press in March 2019. And Sumner, I'll go ahead and turn it over to you.
What I do when we talk about reopening Hawaii tourism is to start off with an overview of where we are in the epidemic. And essentially, it started in early March, and we rose up from just a few cases a day up to 30 cases a day by the end of March. At the end of March, we essentially put into place numerous mitigation measures that were really effective in stamping out the epidemic in Hawaii. We put a 14-day quarantine on trans-Pacific passengers that was imposed on March 21st. Most of the fall in trans-Pacific passengers had come voluntarily as risk-averse passengers canceled their trips to Hawaii. But the 14-day quarantine got rid of the additional 10% that were still coming. We had a 99% fall in tourism by early April. There were stay-at-home orders from March 25th to May 31st that helped to really tamp down the epidemic. There was a closure of non-essential businesses from March 25th to mid-May, and a gradual adoption of masks and social distancing by the public. And so you can see from the graph that when we look into May, we were just getting 0, 1, 2 cases a day. The epidemic hadn't been exactly stamped out, but it was really close. There were small little pockets of it left. And as we reopened in June, though, what we saw was that there was a gradual increase in the number of cases. It became somewhat worrisome in early July. I think we became a little bit complacent in early July as the case numbers, shown by the blue line, that's the 7-day moving average, as the case numbers fell in mid-July. But then from mid-July through late August, we've had an enormous spike in cases, going from about 25 a day up to 150 to 200 a day. So why did this happen? I think it's really pretty clear. Individuals didn't pay enough attention to masking in the presence of peers, family, friends. There wasn't enough physical distancing, particularly again in the presence of peers, family, and friends. The advice to avoid interaction with large groups beyond the immediate household was only partially paid attention to. People decided that some groups were okay and started essentially socializing in large groups. In addition to individual behavior, you also, the DOH and other state agencies really failed to build enough capacity to test, contact trace, isolate, and enforce quarantines. This led to problems that when we had outbreaks, they spread far beyond where they needed to spread. Now, in response to the spike in cases, the state and counties announced new restrictions on local businesses and public gatherings. The state warned that trans-Pacific tourism, which had already been delayed from opening on August 1st, that it might not reopen on September 1st. So how big of a deal would this be if tourism didn't reopen on September 1st? So how big is the tourism sector? So counting direct, indirect, and spillover spending. You know, direct spending being that direct spending by the tourists, the indirect spending being the spending by the tourism businesses, say the restaurateur that puts flowers on the table of the restaurant, and the spillover spending being other people that get jobs from the tourism industry. When employees of the tourism industry spend, the spillovers that create other jobs in other parts of the economy. So I've concluded it's about 25% of the overall economy. On a $96 billion economy, that's about $2 billion per month. What are the keys to reopening Hawaii tourism? I think they're pretty clear. It's safer behavior by Hawaii residents. It's better performance by Hawaii government. And it's putting in place a pre-departure and in Hawaii testing of air passengers that reassures Hawaii residents that that tourists coming to visit are safe, that that they're relatively unlikely to have the COVID virus, to be infected with the COVID virus. Safer behavior by Hawaii residents. I think a lot of the problems come down to bad decisions to treat peers, family, and friends as low-risk contacts. It's one thing to be treating an immediate family group where you're clear about what the risk behavior is of the immediate family group as low risk, but as that group gets larger, as people decide they're going to expand that group, it becomes harder and harder really to ascertain whether or not people are being careful. And all it takes is one person to come in and start to infect a group. In the last 14 days, we've had people infected by extended family gatherings, a hot yoga group, funerals, a birthday party, socializing in bars, fire station, gyms, and a story I know via personal experience is people being infected via a golf outing. Now, a lot of these clusters of cases could have been prevented if the participants had worn masks. Some public health experts have suggested that if everybody wore masks in public at all times, that the virus could be stamped out within a few weeks. In any case, even if the virus couldn't be stamped out within a few weeks, it could really be tamped down to very low levels. In late July, Mayor Caldwell made that recommendation as cases spiked. It's really unclear why Governor Ega turned it down. It would have been great if that requirement had been put in place. I bring up the case of Chatham, Massachusetts, because here's a popular, wealthy summer tourist town, okay, where they have mandatory mask zones. You can look at the poster up there. If you're in downtown Chatham, you must wear a mask for certain hours, 9 a.m. to 9 p.m. If you don't wear a mask, the penalty for not wearing a mask in Chatham is $300. I would note the penalty for violating Honolulu's mask order, which is much more, it's not the same order as Chatham, where if you're in the downtown, you must wear a mask, whether you're inside or outside, regardless of what you're doing. On Honolulu, we have a very differentiated mask order that I think sometimes leads to confusion about when you should be wearing a mask, when you should be wearing a mask. But failure to wear a mask would be a misdemeanor, up to $5,000 fine, up to 1 year in jail. Tim Brown and I argued in earlier work that we did that draconian penalties that allow a court date are neither realistic nor always very effective. I think mask enforcement in Honolulu would be a lot better off if we had a $150 to $200 fine, if it was widely applied to violators and it was treated like a parking ticket. There's always going to be problems in enforcement. I'm not sure that HPD is the right agency. DOH doesn't have the personnel. But I would note that University of Hawaii has trained a little over 450 contact tracers. And we've learned that DOH is in the process of hiring 20 to 40 of these program graduates. Seems to have little interest right now in hiring the 400 others. I would only note that perhaps Honolulu and other counties could use CARES Act money to hire the rest to assist in issuing citations for mask violations. It'd be a good use of the CARES Act money. It would put some people back to work. And it would really help, I think, if people knew that there was people out there who would be reporting them, that they would wear the mask. The $150 to $200 fine, too, I think would act as a nudge to behavior. It would start to be one of those things like a parking ticket where, well, there might be times when people would decide they're going to violate a parking zone, but there's an awful lot of other times when they're going to put coins in the meter. And I think that'd be more effective here than some of the draconian penalties that are in place and that are very hard to enforce. The second element of reopening tourism really comes down to having better government performance in what it does with respect to the epidemic. Again, if we have better individual behavior and better government performance with regards to the epidemic, we'll get our own epidemic under control. If we have our own epidemic under control, then tourists are more likely to find Hawaii a good place to visit. It's hard to believe that tourists are going to come to Hawaii if we have an epidemic that is where cases are constantly spiking. So the DOH has a critical role in that regards. To reopen tourism safely and effectively, DOH needs to have the capacity to test, contact trace, isolate, and enforce quarantine. If it doesn't have that capacity, we could have devastating outbreaks of COVID-19 that we fail to contain, and we risk negatively impacting Hawaii's reputation as a tourism destination if tourists are here and we're having large outbreaks and big spikes in cases. There's one cheer for DOH I'd like to make. It announced yesterday it's introducing a new set of metrics designed to help the public, the media, and decision makers evaluate the DOH response to the pandemic. These metrics are really critically needed because otherwise it's hard to know whether or not the programs that DOH puts in place are effective. The new state metrics are loosely modeled on former CDC Director Tom Frieden's 15 metrics, okay? And the 15 metrics look at things like, metric 2, percentage of new COVID cases linked to at least one other case. Okay? And the target is that we'd be able to link at least 80% of the cases to other cases. That gives us some hint that contact tracing is going to be successful. We'd also want to be looking at the positivity rate. We want to be looking at hospitalization rates, percentage of beds occupied by COVID-19 patients, outbreaks in nursing homes and correctional facilities. It's also really important to have these metrics to be able to evaluate testing and contact tracing. I highlighted number 11s, 12, and 13 in the list of Frieden's 15. Things like number 12, weekly reports on percentage of cases interviewed for contact tracing within 48 hours of testing is particularly important. It's not useful to have contact tracing unless people are going to be contacted relatively quickly. So this is a place where I think DOH, I give DOH one cheer for moving ahead on getting these metrics in place. There's numerous other areas where DOH and the state of Hawaii can make some big improvements. One is I think that we have an ineffective and confused communication strategy. I don't find the press conferences by Governor Iga, Director Anderson, and epidemiologist Park to be particularly effective. It's not that the people are not well-intentioned. I think they're very well-intentioned. I just don't think that they're effective in really communicating the messages that they're trying to get across. And they need to think about alternative ways of getting this information across to the public. I think a lot of the PSA announcements we have are poorly targeted. They're more directed to people who are Frank DeLima's age. We love Frank, but I think Frank's announcements are appealing more to an older group of people. And we see that many of the violators really of, say, masking policy are younger people who are clustering in unmasked groups. There's also a failure to explain to the public what reopening the economy requires in terms of masking, physical distancing, hygiene, and avoiding groups. Reopening the economy doesn't mean that people let their guard down with respect to masking, physical distancing, and hygiene, or avoiding groups. The number of contact tracers that we have, 75 to 100, is far below that recommended by the National Association of County City Health Officials. Recently, UH-trained contact tracers were told not to even contact the DOH about openings. There's complaint about work conditions by overwhelmed and burnout contact tracers. Pacific Islanders, the group hardest hit by COVID-19, 27% of the cases with just 4% of the Hawaii population. They complain about slow contact tracing in their community. Slow contact tracing allows essentially people to unwittingly spread the virus further. DOH still resists testing of asymptomatic contacts. Little effort has been put into isolating asymptomatic contacts living in crowded housing, in particular Pacific Islanders. And while little effort has been put into isolating asymptomatic contacts in this crowded housing, at the same time, CARES Act money is available to isolate these people. And there are thousands of empty hotel rooms across the islands. It'd be nice if there was a well-publicized 1-800 number to report state workers and members of the public not using masks. A daily report of complaints and follow-up by state and county agencies would be really useful. We have more than 150,000 unemployed workers. Perhaps 200 could be hired hourly wages to help with mask enforcement. Whether this is done by the city or the state doesn't really matter. It'd be nice if the two parties cooperated, but we really need to have more people involved in enforcing mask usage. Okay. Pre-departure and post-arrival COVID testing. And in this part of the presentation, I want to emphasize what we're doing now, which is conceptually good and has turned out not to be very realistic in practice, and looking ahead to the new testing environment, which is starting to emerge, and which could be in place by the end of fall 2020. We could see these new types of tests be available, say, in November and December. One of the things that we need to be doing in the state of Hawaii is to be proactive and not reactive. We need to be looking ahead we need to be looking a few months ahead and not just reacting to the current state of where the virus or what our testing regime is now. Clearly, we also need to be moving toward a smart and safe tourism regime. I'm not going to say too much about that in this presentation. Instead, I'm going to focus in on the testing. Okay, Tim Brown and DeWolfe Miller and I have, in previous work, emphasized that there's really two necessary conditions for effectively and safely reopening the Hawaii tourism economy. And the first condition is that tourists need to conclude that it's safe to fly to and from Hawaii, it's safe to spend time in Hawaii, and essentially what that means is that they need to conclude that we have our epidemic under control, that they're not going to come to Hawaii and be infected on the flight or while they're here on vacation. there's a second factor which is really critical too, if we're going to effectively and safely reopen the Hawaii tourism economy, and that's to have residents conclude that tourists will not be a source of community transmission. If tourists are looked at as a source of community transmission, tourists certainly aren't going to feel the aloha spirit. And what we're going to find is that workers in the tourism industry and other residents are going to be fearful of tourists, worried that they're going to be a source of transmission to them and to their families and friends. The state's current plan for screening air passengers is very similar to the plan that DeWolfe Miller and Tim Brown and I developed and put forth in earlier UHERO publication. In this plan, potential visitors take an RT-PCR test, the gold standard of the COVID-19 tests. They take this test within 72 hours of departure. They submit to temperature checks and they answer questions about recent contacts and travel history. And if they get through this, if they get through this testing and question regime, Tim and DeWolfe and I have concluded that this would screen out 80 to 90% of people who are infectious with COVID-19. So the state of Hawaii in its regime says it'll waive its 14-day quarantine for passengers that have a negative PCR test, normal temperature scans, and have the requisite answers to interview questions, such as they haven't recently traveled to areas overseas that have had high disease outbreaks, just being one question. The problem with the current plan is there's severe logistics for the current plan. Let's just suppose that Hawaii tourism from the 12 months from September 1st has 2 to 7 million tourists that come here. So that would require 2 to 7 million tests. On the other hand, just 54 million tests were conducted in the United States since March 2020. Travelers would require, 4% to 13% of all the US PCR tests so far conducted. With the current surge in cases on the US mainland, and we're not the only place of a surge in cases. I think you all realize that throughout the United States, there's been a big surge in cases in July and early August. With this current surge in cases, this kind of test availability seems implausible. Even if PCR testing capacity in the US doubles or triples. There's problems too with one of the providers that might provide the test, CVS, saying it won't test any passengers under 18. And the current delays in obtaining test results in many mainland states, 3 to 10 days, make this idea of people getting a test within a 3-day window really difficult for most people to actually do. I did talk with friends yesterday who are in San Francisco, and they mentioned they can get a free PCR test in San Francisco. They just make an appointment. Results are back within 24 to 36 hours. So there's certainly some places where this type of testing regime could work well, but other places like Southern California, a huge source of tourists for Hawaii. Other places like Southern California, it's extremely difficult to get a test, and then there's a long delay in getting test results back. Same with Arizona, same with Texas, other places it applies with tourists. So suppose that PCR tests remain scarce. One alternative for Hawaii is to use cheaper, less accurate saliva tests to screen visitors. And what we want to ask here is this really a plausible alternative? So here's the trade-off, okay, is that saliva tests, this is another type of test for COVID-19. It's generally a little bit less accurate. I'll talk about that in a minute. Generally a little bit less accurate, but it would allow a lot more frequent testing because they tend to be cheaper. With more frequent testing, more people with COVID-19 infections would be detected. They could isolate, and then when more cases are isolated, this reduces transmission per person, and this helps stamp out the epidemic. Okay, this would also just help stamp out any transmission from tourists going to the local population. Now, there's a lot of saliva tests that are being developed, and I'm going to go over here very briefly 2 alternatives to PCR testing. One is paper strip testing, and another is spit and cup testing, one variety of which is being developed here in Honolulu. The paper strip testing is on the left-hand side, and the spit and cup testing is on the right-hand side. They don't really look too much different, and they actually are pretty much the same as far as what they try to do. Now here in Hawaii, we have perhaps Hawaii's leading technology firm, Oceanic, run by one of Hawaii's leading entrepreneurs, Patrick Sullivan, putting together what's called the Assure 19 test. Okay, so this is a test that uses a simple animal antibody that's relatively available. And one of the things that means is that because the animal antibody is available, we're unlikely to see shortages of the antibody. And a manufacturer of this test could probably scale up for this test relatively quickly. Okay, so for this test, a passenger spits into a person spits into a cup at home, and the results come in 3 to 10 minutes. And the price of this test, Oceana estimates at $20. The test is now in process of testing at Queens. They're testing it to see how well it compares to the PCR test, the gold standard. Earliest availability might be later this fall, earlier winter. Paper strip tests. So the paper strip tests are tests that are being developed by a variety of firms in the Cambridge, Massachusetts area. Their proponents say that they'll be really cheap, $1 or $2 per test. I'm always a little skeptical when people announce that tests are $1 or $2 per test. But this would be versus the $100 to $150 for the RT-PCR test. And even the Oceana test at $20 is an awful lot cheaper than the PCR test. Easy and fast, much like the Oceana test. You can take them at home, spit in a strip, put it in a vial, shake the vial. The result comes back to you in 10 minutes. Now, if this is the case, why aren't we quickly moving ahead with these tests? And one reason is that they're a little bit less effective in detecting the overall presence of the COVID virus in a person. So, and the RT-PCR test does a better job of this. But one reason why we're looking at this test is that the two tests are about equally effective in picking up infectious people. So for the people that have enough virus in them to be infectious, and sometimes people have a very small amount of virus, and with a small amount of virus, they're much less likely to be infectious than when they have a lot of virus. Okay, and so both tests actually do a pretty good job of picking up when you have a lot of virus and you're becoming infectious. So the big advantage on this test is that you could take them frequently. They're cheap enough that you could take this test before you go to work, not just before you travel, but before you go to work to see if you're infectious. Your kids could take it before going to school. And clearly they could also be taken prior to a flight. There's a great video by Assistant Professor Michael Mina from the Harvard School of Public Health, which explains the test. And I listed the video there. So again, what's the difference between the two tests? Okay, so the only vaguely wonky part of this whole seminar pertains to this figure. And in this figure, essentially the vertical axis has the concentration of the virus in the person. And the idea is that the higher the concentration of the virus in the person, the more infectious they would be. The green line there essentially tells us what the sensitivity of the PCR test would be. So the PCR test is going to pick up whether you're infectious, even at very low levels of infectivity. Okay. Whereas the other tests, the paper strip test and the Assure-19 test, would pick up the level of infectivity only at higher levels of the virus. On the other hand, that's not necessarily such a bad thing. If at lower levels of the virus, people are not very infectious, if at lower levels of the virus, if at lower concentrations of the virus, people are not very infectious, then whether or not those people get in the plane may not matter. What matters really is whether or not people have high concentrations of the virus. And it really matters if they get in the plane. And both tests are pretty good at picking that out. So would the paper strip test or other rapid saliva tests be effective in screening air passengers traveling to Hawaii? So if the test is equally good picking up people who are infectious, that's still a little bit in debate if these tests are equally good at picking up infectious people. Then about the same number of infectious passengers would board each flight. And then there's a lot to be said to move to a cheaper test that potential air passengers could essentially administer to themselves at home. But there's a big advantage to these tests. Because the test can be administered at home or on the road as you're, say, driving your 4 hours to your local airport, the window between taking the test and getting on the plane could be reduced. Right now with the PCR test, we say 72 hours because the test has to be sent to a lab. The lab results have to be reported back. Perhaps this window could be reduced to 24 hours, or perhaps even 6 hours before the first leg of flights to Hawaii. This has a lot of advantages because it would substantially reduce the window in which a passenger could take the test and then become infected, and then think that they're negative, but they're actually positive, they're getting on the flight, they're infecting people. As this window becomes smaller and smaller, that becomes much less likely. So essentially, if we move to this type of test, this could actually reduce the number of infected people arriving in Hawaii each day. Because the saliva test is so cheap, we could require a second test upon arrival in Hawaii. Okay, so that'd be maybe 10 to 36 hours after the initial test, depending upon where your flight to Hawaii left from, whether you had connections or not. If the test is positive, the passenger would be isolated and quarantined, and that would mean that people coming off the plane would not be spreading the epidemic in Hawaii. We could even require, if it's $1 to $2 a day, or even at $5 a day, or even at the Oceana test, $20 a day, a test could be required each day of visitors in Hawaii. Again, photos of test results. The airlines could easily get, there could be an app developed where you get your test result. You take a picture of your test result. It's loaded into the app. It's sent to the airlines and the DOH. Okay. This could also be done perhaps via the contact tracing app, which Hawaii is talking about having people download it, online check-in or at the airport or upon arrival in Hawaii. Okay. I want to move away from testing, and clearly I think that even though these paper strip tests and the Assure 19 tests are not available now, they haven't been approved by the FDA. The Assure test is still in testing. That even though they're not available now, they're very likely to be the future. They're likely to be the future because they can be self-administered, they can be done frequently, and they're relatively cheap. And there's a lot to be said to have frequent testing rather than to have one PCR test, the one very expensive PCR test that's administered with great difficulty being done. That one PCR test is going to miss an awful lot of infectious people just because it's being administered so infrequently. There's been talk too about travel resuming from some countries, such as Japan, where the level of infectivity is relatively low, where the epidemics have been somewhat contained. Hawaii is one of the 12 countries regions that Japan is considering for resumption of international travel. Visitors would take a pre-departure PCR test and face COVID testing on return to Japan. There's some technical details that the Hawaii government and the Japanese government are still working on, but it's very possible that we could see travel resume. There's other potential safe travel partners, including Australia, New Zealand, Taiwan, South Korea, and Canada. Hawaii really needs to ask itself, though, why should US or Japanese visitors come to Hawaii if our own epidemic is not under control? You know, really the key to opening up the tourism economy is to control our own epidemic. Let's take a look at some comparisons. So per 100,000 people, how many cases did various places have over the last 7 days? So for Hawaii, 39 cases per 100,000 people over the last 7 days. On the US mainland, it looks pretty bleak. You know, we're talking about trying to open up to the US mainland, but there's a lot of states that send us tourists, such as California, Arizona, and Texas, that have counts that are much higher than us. Now, again, via the PCR testing program of pre-departure testing, a lot of these positive people are going to be screened out. And it may well be not so bad for these people to visit. It'd be nice if these rates went down a bit. And that's certainly something that Hawaii has to consider, whether or not it wants to accept people from the epicenter of the US epidemic. We look at some of these other international destinations. Well, we have New Zealand at less than 1. We have Canada at only 7 per 100,000 people over the last 7 days. Japan at 7. Australia at 14, even though they've had a big outbreak in Victoria State, still just 14 for the whole country. Clearly, Hawaii at 39 would certainly want to have tourists come from New Zealand, Canada, Japan, and Australia. We do have to ask ourselves, would they necessarily want to come here since we have an infection rate that's much, much higher? Again, our key is to lower our infection rate and to make sure if we're going to accept tourists from the mainland that we have a testing protocol in place that works and is effectively enforced. You know, there's always this note too that just because we're opening to tourism doesn't mean people are going to come. Italy, the Italian beach resort of Rimini, known for the place where the Fellini movie, The Clowns, was filmed. This is usually a really crowded summer beach resort. And even though they went to great preparations, Italy has gone to great lengths to control its epidemic, and it is pretty much under control. There's very few people there. There's actually a few people on seats in the background, but there's very few people there. So there is this whole point that we do need to remember too in Hawaii that just because we build it, people still might not want to come. There's certainly some evidence that people are a little leery of long distance travel. Nonetheless, there's an awful lot of people that if we can show that Hawaii is a safe destination, there's a lot of people I think that would like to come to Hawaii. If we don't open up the tourism economy, that's 25% of our economy. That's $2 billion per month. We could easily face a depression in the year 2021 as federal aid is phased out. Right now, we're not in that situation because even though our output has fallen about 25% because of the total shutdown of the tourism economy, income has not fallen nearly that much because of the relief expenditures from DC. But those will be phased out. In this presentation, I'm really trying to make the pitch that we need to look beyond the expensive PCR tests and start planning now to use some of the cheaper saliva tests to screen tourists in 2021. And we need to insist and incent tourists to install contact tracing apps on their phone. It's important for us to think about how we can essentially use electronic technology to control the spread of the epidemic, not just to rely upon human contact tracers. That's about it. Thank you very much.
Thank you, Sumner. Appreciate that in-depth look at COVID within tourism and specifically in Hawaii. We are going to begin our Q&A session now, and joining Sumner are his colleagues Tim Brown and DeWolfe Miller. Tim Brown is a senior fellow in the research program at the East-West Center. His primary focus is on infectious disease modeling and its applications to public policy. He currently works with Global Fund, Avenir Health, and other global and national partners to develop estimation and projection tools and methodologies for countries, implement more comprehensive policy analysis of HIV epidemics and effective responses to them, and support the development of improved strategic information systems in Asia and the Pacific. DeWolfe Miller holds an MS in virology and immunology, an MPH in environmental health, and a Ph.D. in epidemiology. He is a fellow in the American College of Epidemiology and professor emeritus in tropical medicine epidemiology at the John A. Burns School of Medicine, University of Hawaii. Professor Miller was twice a senior Fulbright scholar to Egypt. We are so glad to have both of you join us here today. Tim and Dee will answer most questions regarding public health. And we do have quite a few questions coming in. So let's go ahead and get started here. First question, top of the list here, most votes, most interest in having it answered. Should tourists be tested before and during visits?
You want to take that one, Dee?
I think that's a good question. I'm glad it was asked. I think they ought to be tested before they get on the plane and depart. This is right out of our paper that the three of us published together, is depart, be tested first, or be quarantined later. And so then they should be tested before they depart. And with the advent of these new saliva tests, they should be tested after they get here too. I mean, this is something that we really need to get implemented as soon as possible.
Anyone else for that one?
Well, I want to agree with Dee. I think that, increasingly what we're seeing, when we did the original paper where we were looking at the pre-flight test, the situation was quite different than it is today. I think the epidemic on the mainland was much more stable. The epidemic here in Hawaii was basically under control. And I think we're in a very different world right now. We clearly do not currently have the capacity to control the local transmission. Therefore, every additional bit of external transmission that we're introducing is making the situation that much worse. So I would agree with Dee. I think that, as the testing technologies improve, we need to add some additional tests once people have arrived here.
Okay, thank you. And in regards to testing, another attendee has asked, I still have not seen a viable plan from the governor on how testing for tourists will happen. Does one exist? Last this was addressed, there was not the capability from CVS or any other vendor to do this.
Again, I think the challenge that we're facing is that we don't have a clear picture of what the governor's plan is. I mean, we hear occasional public pronouncements of things, but we've seen no consistent plan, no consistent approach come out of them. And so all we get is basically what tends to leak out of various government committees and so on, and we don't have a clear picture of what that actually is at this point. So it's very difficult really to comment on it.
Do you anticipate at some point something coming together where we'll get some more clear instructions on next steps and how testing really can be executed in this way?
Well, I think this has been one of the failures in Hawaii from the start in terms of transparency for the public. The public does not, for example, currently know what our actual testing policies and strategies are. Are asymptomatics tested or not tested? We get differing reports from differing people. So we don't know what the testing strategy is. Similarly, we don't know what the tourism reopening strategy is at this point. And we actually don't even have a clear picture of what the overall Hawaii reopening strategy is, because all I've seen on that is one rather colorful presentation that the governor put out on it, but I haven't seen any details on what goes into the different stages and so on and so forth. So I think transparency is something we urgently need here.
I think we're also left with this note that I don't think there's many people in Hawaii that would like to see tourism resume without pre-departure testing. And yet on the mainland, pre-departure testing is going to be very difficult to get in certain geographical areas just because the epidemic is surging, and people who are symptomatic are having problems getting tests and getting them within a reasonable time frame. But I think that there will be still a reasonable number of people that will find a way to get a test. You know, I mentioned the example of San Francisco, where I think tourists from San Francisco and from the Bay Area in general could probably find tests. People from Southern California probably couldn't. The result of this would be that we're going to have a lid put on the number of tourists that will ultimately come here. We're going to start off at relatively low levels, and hopefully, if the mainland epidemic falls back a bit, as it could, what we'll find is it'll become easier to get tests, and that we'll find over the course of the fall that more people will come. But the availability of testing, I think, is going to put a lid on the initial opening. That doesn't mean, though, that we shouldn't move ahead and do this. We need to figure out if there's problems with the testing procedures. We need to figure out if there's problems as people arrive here in Hawaii. We need to iron out any kinks in the system in September and early October. As tests become more available, you know, we may well see the system work. And again, what I argued in this presentation was that we need to be moving over to more rapid, self-administered, cheaper tests that potential visitors will be able to get.
Okay, and to that same point, actually, another question regarding who should be testing. Should tourism entities pay for tourist tests and be responsible for tourist quarantines? What do you think?
Well, you know, this is one of these things that we could, if what we're trying to do is to subsidize the opening of tourism, we could do that. Or people could look at this as just another cost of visiting Hawaii. If we're talking about the PCR test, we're talking about $150 plus the trouble you have to go to get the test. For moving over to the saliva test, they're much, much cheaper. And I think then just costs, whether we're talking about the $20 or the $1 to $2 of the alternative test, the cost would be so much lower that we really don't need to worry about subsidizing. I think, again, we need to be starting to focus on where do we want to be in November, December. We already have at least the outline of a testing plan right now. We got to stick with that basic testing plan for the next few months. But we need to be thinking about where do we want to be as the late fall winter tourism season approaches.
And the other thing I would add to what Sumner just said is I think also we might want to look at this slow initial opening because of limited availability of tests on the mainland as an opportunity to get our own house in order. We basically need to be sure that we can actually contain and control the epidemic here in Hawaii first before we open up in any substantial way. And right now, we clearly have not evidenced that. So I think we need to get that in order before we're ready to reopen.
Okay, and in terms of reopening, what do you think will happen to Hawaii's tourism recovery and economic recovery if the state rolls back some phases of reopening and institutes another inter-island quarantine or other restrictions?
Well, I mean, rolling back is certainly not going to help the economy, but let's just remember the following, that in the intermediate run, beyond say the next few weeks or so, if we're talking about the next few months, there really is no trade-off between controlling the epidemic and revitalizing and reopening the economy. If we're going to have a strong economy, which implies a vibrant tourism sector, we have to have the epidemic under control. Okay, it's not as if there's a trade-off between controlling the epidemic and the economy.
And I think also the other thing I'm going to add on that, when it comes to inter-island quarantines, I think that we need to consider what the epidemiological situation is on Oahu relative to that on the neighbor islands. The neighbor islands still have this under control. Oahu does not. So Oahu is actually a threat to the neighbor islands if we don't reinstitute inter-island quarantines at this point in time, until such time as Oahu does actually get things under control.
Right,
Yeah.
Tim, and that's what the mayors were discussing yesterday.
And I do want to just give a reminder to our attendees, we have about 10 minutes left and 67 questions, so we are most certainly not going to get through all of those. But I would encourage you to give a thumbs up to those questions that you want to see answered the most, so we can make sure to prioritize those. I'm mostly just going top down here, working them in as appropriate. So another question, why not take this opportunity to diversify the economy and protect the economy from these periods where we have no economy because tourism is halted? This is the third time in less than 20 years that tourism has taken a major hit. This is a frequent question. While we have the opportunity, while tourism is slow or lagging, why not put our resources into other industries? Could you answer that?
Okay, so that's let me just start with this premise that we haven't been diversifying the economy. If we go back and we take a look at how big was tourism, say in the late 1980s, early 1990s, the answer was it's about 35% of the economy. We take the direct, indirect, and multiplier spending into account. That's fallen from 35% down to 25%. We actually have been diversifying the economy. The bottom line is that tourism is still a big part of the economy. I really do believe that we need to take more efforts to diversify the economy in the sense of encourage other industries that Hawaii is likely to have a comparative advantage in. That can't be done overnight. I just don't believe there's overnight solutions to this. But it's really time for the state to really start thinking about how is it going to encourage the growth of other industries besides tourism. That said, we really need to remember too, I don't expect to see anytime in the next 30 years that we're going to see a Hawaii economy that has less than 20% tourism. And the reason why is that this is a great place to visit. It's a great place to visit. There's all sorts of industry. There's all sorts of reasons why tourists want to come here. But still getting that other 5% in place is really important, because those other 5% could conceivably be pretty good jobs. Jobs in the tech industry, jobs in renewable energy. There's a variety of other industries that we need to be thinking about how to do this in. But that's not, I would be shocked if that can be done overnight.
Sumner, to that same point, is there something to be said about having a strong economy? Obviously right now that includes tourism, but a strong economy is a base to be able to attract private investment into other industries or to generate enough tax revenue to invest in other industries.
Well, it's clear that we need to be looking very seriously at why is it that other industries that we think have potential here are not expanding very fast. I mean, I look at things like the renewable energy industry, and I see an antiquated system of state regulation at the Public Utilities Commission as partly responsible for this, an antiquated system of regulation that slows down the advancement of these renewable energy projects. There's other areas like essentially high tech, where we had these tax credits in place that were really absurd from 2000 to about 2010. We ended up repealing them because they're so absurd. And yet, just because you have a bad policy in place that you get rid of, we haven't done much in the last, we haven't done all that much over the last 10 years to really ask ourselves what the critical set of state policies is that might help to attract high-tech industries to Hawaii. That needs to be done. And I see some efforts toward this goal, but yeah, we need more concentrated, more effective efforts.
Thank you. Tahiti and Alaska, starting August 11th, no longer offer quarantine as an option for visitors and mandate pre-testing. Do you think that Hawaii should do the same? We've talked a lot about the importance of testing. Do you think we should get rid of the quarantine if we can do more aggressive, more effective testing measures?
I think if we can do testing on this end, then it might be possible to eliminate that. If you look at Bermuda right now, what they actually do is they require 4 tests of visitors. The first test is administered at the airport upon arrival, and there are 3 tests given at different periods through the 14-day quarantine sort of period. They're not in quarantine during that time, but they are basically required to do these additional tests. So yes, if we had more testing capacity and the ability to use, for example, cheaper and faster tests, it's entirely conceivable to do that. Without the test, then we really need to maintain the quarantine, because otherwise we have no way basically of stemming the flow of infections into the state. And I think that that, remains a significant bottleneck in terms of people coming back, because they don't want to come back if they are going to be in quarantine. But the problem we have is that our quarantine is not enforced right now. And that definitely needs to be stepped up. We need probably somebody other than Department of Health basically in charge of quarantine and ensuring that people are respecting the quarantine and make sure that it's actually happening. And that's been a major failure of our response so far.
Who do you think?
I think if we tried to require the test, that would be subject to constitutional challenge. It's just not clear how that would end up. And I think that's probably why we haven't moved to eliminate the quarantine. If we felt that I think if the state felt that it could do that, it would move to requiring the test. But there's difficulties in doing that right now.
Tim, to your point with the difficulties in enforcement among the visitor arrivals, looking at returning residents, is there any more recent data on whether returning residents have continued to be a source of spread in the community?
We don't know. Again, Department of Health has not really shared that data. We don't get any breakdowns by returning residents versus visitors. The only thing we get is local transmission, and we're not actually, totally clear whether a lot of that is related to returning residents or not. So I think it's very difficult for us to know, given the opacity at the Department of Health right now.
Okay, but we know it's likely going to be some of those arriving individuals, whether residents or visitors. We just don't know what the breakdown might be.
Exactly, and we also don't know how well quarantine is being enforced with them. I do know anecdotally from a friend of mine who came back from Las Vegas that they only received 2 contacts during the entire 14-day quarantine period to check whether they were adhering to quarantine. So it's not being enforced very strongly or followed very strongly.
I've also heard anecdotally that the process for returning residents is very different than the process for visitors, and that there's not always an immediate method of tracking who those returning residents are, who of course could be just as much in danger of spreading community risk. So yeah, certainly issues with enforcement. Next question, is the public getting enough information about all the places where people are getting infected or contracting COVID-19? The city and county of Honolulu and many businesses are self-reporting positive cases among employees, which is good, but where did the golf exposure happen, for instance? Given the bar decision, should golf courses also be ordered closed or other similar restrictions?
Well, that's a real good question. I mean, for example, on the golf one, that's just one that I know because that was a friend of mine's parents who a buddy came from the mainland. They played around to golf. I don't really know what the circumstances was, but then both of them became infected. The person's wife became infected. It's not clear if it spread beyond that. But
At Sumner, I want to add to this because we really don't know how that transmission occurred. It may not have anything to do with golf. But then again, I don't want to exonerate golf. I want everyone to be compliant in taking measures to interrupt transmission.
Golf in and of itself, the golf industry has really taken a lot of measures to try to make it a relatively safe experience.
Getting into any particular activity gets to be more than we can address here in this
Absolutely.
forum.
I agree.
And so I just want to just reiterate that we really need everybody to help us help everybody else get on the program. And we can prevent it's interruption of transmission is what we really need to do right now.
Yeah.
You can see that I'm kind of upset about it.
Well, I think, if I might add to that as well, I think what we've got here is a failure of public messaging. The Department of Health, the state in general, have done a very bad job of explaining to the public what's really necessary in terms of reopening. I think people were just told, oh, you can gather in groups of 10 without understanding why groups of 10, even as a restriction. But if groups of 10 are 5 couples from 5 different households, that's a COVID party. That's not a group of 10, that's a COVID party. And I see that at restaurants and bars and everything else around this Kakako area where I live every day when I walk by places. And so people do not understand where the risk is coming from. And without that understanding, they will not take the precautions.
I agree with Tim completely. You have 10 people and none of them are distancing, none of them have masks on. That's 9 too many people. It's like, but you could have a lot of other people doing good things that interrupt transmission, and you could have 10 people doing something together. We have to have places where we're working and being productive, where we have to take, how do the guys in the hospitals work? They work cheek to jowl, but they take preventive measures. In some cases, of course, they have a lot more PPE on than we want to walk around in. But it's possible to actually do a lot and still be safe. And that's what I'm really trying to strive for here.